Cervicogenic headache is basically a headache that generates from the neck, specifically the upper 2 to 3 segments. They can arise as a result of trauma. It can be from posture, stress, bad sleeping position. A lot of people sleep on their stomachs and that can be a problem. Whiplash is a common reason that people get it. We see that a lot in patients that get rear-ended. Sometimes weightlifters get it as well. Any kind of trauma where the head and neck kind of whip back and forth, specifically forward and backward, although you can still get it from a side to side, like a T-bone collision, something like that. Cervicogenic headache does differ from other headaches in some ways. There are a lot of overlapping symptoms there. I mean, you have, typically it's like a deep kind of ache, in the neck or like the back of the head area, as opposed to, there can be throbbing headaches or like a cluster headache that might be like a very sharp pain right behind the eye. So it's typically like a more of a deep pain. So if a patient comes in with what I suspect is a cervicogenic headache, usually the first thing I would want to do is rule out any red flags, something more serious going on, like perhaps a stroke or a tumor, something like that, a fracture. If they've had an accident, if they haven't already had x-rays, we would order those. Once anything more serious is ruled out, then typically we'll get into the treatment part of things, which could include, anything from adjusting joints that might be stuck in the neck, especially those top 3 vertebrae. There's 7 vertebrae in the neck, and the top 3 are typically associated with that kind of headache. So checking to see if there's any restrictions in those joints is always a good thing. And then if there are, we do, it's kind of a quick movement with not a lot of force that you'd see, a lot of people have seen adjustments where there's like a popping sound or two, in the neck when you get adjusted. So that's one of the treatments that we would do. A lot of times with that, joints that aren't moving properly in the neck, there's also muscles that get tight as well. So we would do different types of muscle work for that. The soft tissue work is definitely a huge component of fixing a cervicogenic headache, probably just the same as the adjustment. Those two combined, typically we see very good results.